As Jennifer said, we are partners in our practice, but a little not so secret is that we also happen to be sisters. And I'm not sure if any of you have ever tried to write a PowerPoint presentation with your sister. We hadn't done this before either, and I'll just say that this will be our first and last joint presentation today.
Okay. I want to start with sharing a Mark Twain quote. This quote has proven true throughout my medical career. It ain't what you don't know that gets you into trouble. It's what you know for certain that just ain't true. For every time that I have to learn something new, it seems I have to unlearn more. And I believe having an open mind is critical to our success and progress in medicine. Today, we're inviting you on a journey to explore a new understanding.
We'd like you to consider the possibilities of a healthier, more vibrant nation. Today, you may witness something you previously didn't believe could happen. How would you feel if I told you disease does not exist? Let's sit with this for a moment. I'd like to explain it with an example. You go to your physician, you're having difficulty focusing, and after a thorough evaluation, your physician diagnoses you with ADHD. What does this really mean? Do you have ADHD? Is there some concrete physical brokenness in your body that is ADHD? No. You have a constellation of symptoms, and that is why you have been diagnosed with ADHD. The disease isn't a specific thing in your body that you have. It's not a genetic brokenness. It doesn't tell you anything about what's causing your symptoms or how to treat it. It's a label. We know your ADHD can be healed by addressing the underlying root causes. Maybe it's a combination of sleep disorder, microbiome imbalance, high toxin burden, but your ADHD is completely different than someone else's ADHD. Thank you. You do not have a disease. You have imbalances that can be recovered through a functional medicine approach. This image could represent any disease. As you can see, the ADHD symptoms in this example are only the tip of the iceberg. In order to heal the illness, we must address the whole picture. Conventional medicine focuses on elimination of symptoms through the use of pharmaceutical medications. And while I'm grateful to have those pharmaceutical medications when appropriate, sadly, by eliminating the symptoms of the illness, they can mask the underlying ongoing dysfunction that, if left unaddressed, will progress to more severe illness. For example, let's say your ADHD is caused by gluten-induced autoimmunity to the brain. So you take Adderall and you can focus. But sadly, your brain injury from your gluten-induced autoimmunity continues. We have a systemic misunderstanding among doctors and patients that if you eliminate the symptoms of an illness, you've treated the disease.
I want to introduce you to a boy named Carter. I hope that Carter's story helps to illustrate how we approach medicine differently when we know the root causes of our health conditions. Remember Carter's story. We will talk more about Carter later. Carter was born at term by a C-section after a pregnancy complicated by toxic mold in their family home. His mother's history was significant for vegan nutrition as well as infertility. When Carter was only 4 months old, he developed an ear infection and was given antibiotics for the first time. After that, he began to have chronically loose stools and eczema on his skin. Multiple other antibiotic courses were given over the course of Carter's first year of life. Leading up to his first birthday, Carter's parents reported that his development was normal. He was a happy, engaged baby. He had more than 10 distinct words. He had strong eye contact, was described as very affectionate, and was also a great eater. At a year of age, Carter developed another illness, thought to be a viral infection, and later an ear infection, and was placed on antibiotics again. At this same time, Carter also received multiple immunizations. Over the next week, Carter's development regressed dramatically. He was no longer doing things that he was doing before. He was not interested in playing with other children. He was no longer interacting with his family, was only eating oats and tortillas, was barely babbling anymore, and wasn't responding to his name or even making eye contact. I met Carter when he was a year and a half or 17 months old. I had the difficult responsibility of letting his family know that he was developing symptoms consistent with autism. He was later referred to the UC Davis Mind Institute, where he was formerly diagnosed with this condition. How many of you know someone who's been affected by autism? In the 1970s, autism was estimated to be around 1 in 10,000 children. Today, the rate of autism is 1 in 59 children and 1 in only 37 boys. It has been disproven that this increase is related to improvement in diagnosis. The lifetime cost of care for one child with autism is around $2.4 million. In 2015, autism cost the United States $268 billion. This was 3.6% of our GDP. Also, this was more than what we spend on national defense. In 2025, it's estimated that this spending will reach $1 trillion. When I looked at these numbers just a couple years ago, it's increased by more than 3 times. Our country's not alone in this. In the UK, autism costs more than heart disease, cancer, and stroke care combined. You know, as staggering as these numbers are, even more so is the level of human suffering. So why do we need a new approach? Autism is only a single example of an epidemic in chronic disease in our country and actually across the world. So the World Health Organization now endorses chronic disease as the leading cause of death worldwide. This, for the first time in history, has surpassed infectious diseases. Let's talk about healthcare costs as a whole in the United States. So in 2018, we spent $3.6 trillion on healthcare. This was 18% of our GDP. This is also more than the combined budgets of national defense, homeland security, education, and federal welfare. This spending has also almost tripled in the last 20 years. This may be worth the cost if we had great outcomes, but unfortunately, our current healthcare system is just not working. Johns Hopkins research from 2019 confirms that of the top 11 industrialized nations, the United States is last in quality of care for healthcare, but also has the highest per capita expenditures by far.
Okay, so let's illustrate this with Carter's story. Here is a graphic of Carter's timeline. This is a tool that we use in functional medicine to help us organize our patient's story and to look for patterns that illustrate for us what could be causing the dysfunction. What do we see in Carter's timeline? We see that before he was even born, his mother's history of infertility, mold exposure, and vegan nutrition set him up for increased vulnerability to disease. Throughout his first year, he had multiple infections and was treated with multiple courses of antibiotics. You can see here at 4 months that after an ear infection and antibiotics, he developed chronic loose stools and eczema, both signs of gut dysfunction and malabsorption of nutrients. Over the next several months, his growth fell off the growth curve, and he was failing to thrive. We see then at 1 year that he had the perfect storm, another infection, received multiple immunizations, and was placed on antibiotics again and within a short few weeks, he had evidence of brain inflammation and developmental regression, which was ultimately diagnosed as autism. So what else do we know? From a functional medicine perspective, this is our understanding of what happened in Carter's body. Carter's antibiotics at birth, and then again multiple times throughout infancy, caused significant imbalance in his microbiome, which results in increased intestinal permeability and ultimately significant immune dysregulation. We'll explain this in detail. The immune dysregulation increases his risk of autoimmunity. And after a combination of insults at 1 year, he developed autoimmunity to the brain, which ultimately caused regressive autism. So let's break this down, starting with the microbiome.
Did you know that 98% of the DNA in the human body is actually from microbes, meaning we're effectively only 2% human? Thank you. Our microbiome consists of a vast and diverse balance of these microbes, bacteria, fungus, and other organisms that live lining our body's surfaces, including the skin, the intestines, and more. It is an intimate partner in many of our gut functions. Each species has their own role in our health, and we know that antibiotics cause significant imbalance in our microbiome. Studies that have followed the gut microbiome after antibiotics have shown that a single course leads to lifelong imbalance. We see deficiencies after antibiotics in needed healthy bacterial strains, as well as overgrowth in other microbes that are selectively not killed by the antibiotics, like fungus, protozoal, and parasitic infections, and more resistant bacteria. Due to most of our microbiome developing in the first 3 years of life, antibiotics in infancy have a much more deleterious and longer lasting effect. The AAP just this past month reported that research shows infants delivered by cesarean section have significantly increased risk of allergic conditions, autoimmune illnesses, as well as leukemia. In functional medicine, we understand this risk to be related to the health of the microbiome. Infants born by C-section are exposed to antibiotics given to the mother at the time of the surgery. They also don't benefit from exposure to the mother's flora by passing through the birth canal. Both of these factors significantly impact the health of their developing gut microbiome. So how does the disruption of the microbiome lead to increased intestinal permeability and dysfunction of our immune system?
This is a picture of your intestinal lining, and we'll start with what's optimal, which is on the left side. The intestinal lining provides an important barrier function, keeping the outside world out, which is actually what's inside the intestinal lumen, until normal processes like digestion have occurred. Let's say you eat an egg. An egg is made up of protein that is in a sequence of amino acids specific to chicken, not human. And in normal processes, we digest that protein down to individual amino acids that then are allowed to transfer across the gut lining and are presented to the immune system prior to being allowed to enter the body. Normally, individual amino acids, which are shared between the chicken and the human, are known to be not a problem by the immune system and are allowed to pass through. Let's see. The microbiome itself is actually really important in maintaining the health of this lining. After antibiotics, when we develop overgrowth of certain strains of microbes, this overgrowth triggers an immune response, which sadly causes breakdown of the intestinal lining and results in increased intestinal permeability, allowing now that incompletely digested egg protein or microbes to pass through the intestinal lining to see the immune system. This induces a really strong immune response that over time, with chronically active inflammation, can lead to increased risk of autoimmunity. So let's move from dysregulated immune system to the causes of autoimmunity.
So because 75% of our body's entire immune system lives lining the intestines, when we have immune activation at the level of the gut, it can actually lead to systemic allergic and autoimmune conditions. Our immune system essentially has two main functions: tolerating what is self or part of our body, and responding to or reacting to non-self or what is deemed a foreign invader. Let's talk about allergy first. So remember when we ate the chicken egg. Let's consider what would happen if we had increased intestinal permeability. As Nikki mentioned, that intact egg protein would be allowed to cross the lumen and be seen by the immune system lining the gut. This now large chicken protein is reacted to by our immune system because it no longer looks similar to the human proteins our immune system's used to seeing. We essentially have just developed an egg allergy, and we know that antibiotic exposure increases the risk of allergy. There's a large body of research that actually confirms this. Not only is there increased risk of allergy with increased intestinal permeability, there is also increased risk of autoimmunity. Autoimmunity, in a simple term, is when the immune system attacks our own body's tissues. When we see Carter's case, we know that he had inflammation and immune dysfunction that caused developmental regression. Research has shown that at least 30% of the cases of autism have been found to have autoimmunity to the brain, or what is called autoimmune encephalitis. There are three factors that predispose people to the development of autoimmunity. One is our genetic predisposition. The next is that increased intestinal permeability and immune dysregulation. And lastly, there will be environmental triggers. Anything from infections like viral or bacterial illnesses, immunizations, foods, toxins, medications, chronic stress, and more. Of the multiple proposed ways in which autoimmunity develops, one includes a process called molecular mimicry. This is when an environmental toxin contains a protein that is similar to a protein in our own body's tissues. Our immune system reacts to that foreign protein, but will also inadvertently react to a tissue in our own body. An example of this is streptococcal bacteria. I'm sure most everyone has had strep throat in the past. Strep bacteria contains a protein called M protein. This has significant overlap with a protein of human brain tissue. Autoimmunity to the brain after infection with strep is relatively common, especially when there's a genetic predisposition combined with an underlying current of immune dysregulation at the time of the infection. You may have actually heard of this specific autoimmune condition. The acronym for it is PANDAS.
What else do we know? We know that autism is a complex disorder, and there's lots of different types of autism. While a small proportion are genetic and some causes are unknown, the majority of cases are thought to be immune-mediated. Immune-mediated autism results from brain inflammation during specific ages in development. And there are two main types, one in which the brain inflammation occurs before birth and is linked to maternal autoimmune antibodies to the brain. The second is in which the autoimmune antibodies develop during infancy, and that is the case in Carter's case. There are several studies connecting autism and autoimmunity. Simply having a family member who has been diagnosed with any autoimmune disease increases the child's risk of being diagnosed with autism by as much as 28%. And if a parent has type 1 diabetes or autoimmune hypothyroidism, this increases the risk by as much as 64%.
Now we'll move on to the exciting part, which is Carter's recovery. Carter's lab results uncovered imbalance of his microbiome, chronic inflammation and malabsorption within his intestines, multiple food sensitivities, nutrient deficiencies, and a high body burden of toxins. These toxins included heavy metals and mold toxins as well. These factors combined with genetic predisposition uncovered were all contributing to cellular dysfunction and processes mentioned earlier with methylation and the function of the mitochondria. These cellular processes are critical to the developing brain and are studied extensively in relationship to autism. So now that we knew the root causes of Carter's developmental regression, we were able to personalize his care to work towards reversal of these factors. Over the next 4 months, we implemented what is called the Functional Medicine 5R program for intestinal healing. As you can see, there are 5 steps, the first of which is to remove things like inflammatory food proteins from food allergies or even food sensitivities, removal of toxins, infection within the microbiome. Next, we replace supportive factors like fiber, micronutrients, digestive enzymes, and stomach acid. We then need to re-inoculate that microbiome that was damaged. Prebiotics feed the microbiome, and probiotics help to encourage growth of more supportive balance within the gut. We then repair that gut lining we talked about that has been injured and is more permeable. Nutrients such as zinc, vitamins A, D, and C, amino acids like L-glutamine, all help with cellular healing on the lining of the intestines. Lastly, but very importantly, we need to rebalance. When we rebalance, we address the nervous system. Dr. McCarthy talked about this in part, but our nervous system essentially has 2 main modes, our fight or flight response and our rest and digest response. And if we don't support stress to increase the strength of the rest and digest response of the nervous system, we aren't able to heal. So more specifically for Carter's case, he was started on a nutrient-dense, low-inflammatory style of nutrition that removed gluten, dairy, soy, refined sugars. Our functional trained dietitian supported the family in this, as well as expanding Carter's diet. Despite their vegan nutrition, they agreed to add liver and egg as medicine. They also moved out of their moldy home and eliminated EMF exposures to the best of their ability. EMFs include things like Wi-Fi. We added prescription as well as herbal support of his microbiome imbalance, started probiotics, encouraged fermented foods, and repleted nutrient deficiencies. During this time, we gently supported his detoxification pathways to eliminate the toxic burden within his body. And in order to address his nervous system, he began a therapy called craniosacral therapy. He had an occupational therapist throughout this time as well. Within 2 months of this initial plan, Carter's loose stools and eczema resolved completely. But more importantly, his developmental regression had come to a halt. At the end of a 6-month period, Carter's speech had improved to average for age. His growth percentiles had recovered, and I will never forget the tears in his mother's eyes when she reported to me that he now tells her, "I love you." Over the next 2 years, Carter and his family continued to follow this plan with alterations whenever they were needed. He had recovered completely from his autism by age 4. He is now thriving in mainstream kindergarten, and his autism diagnosis has been removed. So James mentioned this, but some people have concerns that functional medicine is too expensive. It is true that it takes us more time. We have to slow down and think through our patient's individual uniqueness. I probably saw Carter 20 times for about an hour each visit. An hour-long visit may pay about $200 from insurance. We performed $1,000, I would say, or so in laboratory testing for Carter. So his functional medicine care did cost around $5,000. But as we mentioned, it led to a reversal of his autism. The lifetime cost of care for a child diagnosed with autism is $2.4 million. We cannot afford to not practice functional medicine. You can see we're a little jumpy. I'm going to share a letter with all of you from Carter's mother. Dear Dr. Katie, I've been trying for the last year and a half to express how thankful we are to have found you. Every day since we found out about Carter's condition, we have known that God brought us to you. When Carter was born, we had been married over 10 years and had wanted a child ever since. I had surgery for a tumor, which resulted in major complications. Long story short, many professionals told us I could never carry a baby. After trying to conceive without success, I made an appointment with the adoption agency. A month after scheduling this, we found out I was expecting. That day and every day following in my pregnancy, I had no caffeine, sugar, pre-made foods. I didn't wear makeup, use nail polish, or any unclean products of any kind. I carried him for 3 days past my due date and was so excited in the hospital. Everyone in our family came to see our miracle baby. Ever since Carter was born, every decision and action in our family has been centered around him. When we met you and found out what was happening, it shattered our world for a moment. Not out of anger or wondering why, but sheer shock that we could have and almost did lose our miracle. I know that I get very emotional at our visits, and it's literally the overwhelming thankfulness for all of this happening. The fact that you saw and acted upon your instincts saved our son and our entire family. We are not just willing, but are happy to do whatever it takes for him. We are thankful for the path of his life and to God for meeting you. I wanted you to know more about who Carter really is and what you have given us, which is Carter in our life. He is so incredible, and we have nothing but faith for his future now. You will never know what you have really given us, but I hope we will be able to show you how much love and appreciation we have and always will have for you. Thank you for saving my sons and my life. All of my love, Heather. This is why I do what I do. Each of my patients is unique and holds a special place in my heart, but I'm happy to report that we are in partnership and care for multiple children with symptoms and recoveries similar to Carter's. That being said, if Carter had been my only patient, my only story of success, I would know that my long hours, entire training, and lifelong commitment to expanding my education were worth every second.
Can we imagine a world where chronic diseases like autism were recoverable? In this world, we would no longer focus our medical care on eliminating the symptoms, but treat the underlying causes and cure the illnesses, providing long-term vitality and well-being to our patients. Imagine the quality of life differences we could make. Whether it's eczema or irritable bowel syndrome or autism or dementia. The functional medicine map provides a guideline for us on how to help uncover the imbalances and cure the diseases. As future medical leaders in America, this is what you were called to do. This is what you were meant to do, and this is what we can do. Thank you.